The nurse walked with a limp, and that's all the ER staff seemed to notice. They didn't notice the way her eyes swept every corner of the trauma bay before she stepped in. They didn't notice how she positioned herself near the exit with a clear line of sight. They noticed the limp, the faded scrubs, and the quiet way she moved through the hall like she didn't belong. And in a place like this, where ego and adrenaline ran hotter than the coffee, being quiet meant being invisible, or worse, being a target. It started on a Tuesday night, the kind of shift where everything breaks at once. The ER was slammed. Ambulances stacked up outside like a convoy. Inside, it was chaos. Nurses sprinting between beds, residents barking orders, the attending physician pacing near the nurse's station with his phone glued to his ear. And then there was her, the new nurse, the one who limped. She'd been there less than a week, floated in from another facility with no fanfare, no introduction, just a quiet presence that some of the staff had already started whispering about. She didn't talk much, didn't crack jokes at the desk, didn't try to prove herself. She just worked, and for some reason, that made people uncomfortable. One of the senior nurses, a woman named Diane who'd been running that floor for 15 years, didn't hide her annoyance. She'd seen dozens of new hires come and go, and this one didn't fit the mold. Too quiet, too stiff, and that limp, it was slow, deliberate, like every step hurt. Diane muttered to a resident during a lull that maybe the new girl wasn't cut out for the pace of emergency medicine. The resident smirked. Another nurse overheard and nodded. It became a thing. Not loud, not cruel, just the kind of low hum that builds when people decide you don't belong before you've even had a chance to prove otherwise. The limping nurse didn't react. She stocked supplies. She checked 4 lines. She responded to call lights without complaint. And when a trauma alert came through around 11 that night, she was the first one at the bay doors, gloves already on, eyes sharp. The others barely noticed. They were too busy prepping the room, pulling gear, shouting updates over the radio chatter. A military convoy had been hit during a training exercise just outside the base. Multiple casualties inbound. High priority. The attending snapped his fingers and started assigning roles. Diane took the lead trauma nurse position. A younger nurse grabbed the medication cart. The resident positioned himself at the head of the bed. And the limping nurse? She stood near the corner, hands loose at her sides, waiting. When the doors burst open, the room exploded into motion. Paramedics rushed in with the first patient. A young Marine, mid-20s, unconscious, blood soaking to the bandages on his chest and leg. His vitals were crashing. The attending started calling out orders. Diane moved fast, but her hands were shaking. The resident fumbled with the intubation kit. The younger nurse froze for a second too long when she saw the amount of blood. And in the middle of it all, the limping nurse stepped forward. Not loud, not dramatic. Just a single smooth motion that put her at the bedside, her hands already assessing the wound before anyone else had processed what was happening. Diane shot her a look. "We've got this. Step back." The limping nurse didn't step back. Her fingers moved across the Marine's chest, firm and precise, checking for tension pneumothorax. She leaned in close, listening for breath sounds, her face unreadable. Then she looked up at the attending and said, calm as glass, "He needs a needle decompression. Left side. Now." Diane bristled. "We don't have confirmation. He's at absent breath sounds and tracheal deviation. If we wait for imaging, he's dead in 3 minutes." The attending hesitated. He didn't know this nurse, didn't know her background, but something in the way she said it, no panic, no doubt, just cold certainty, made him nod. "Do it." Diane's jaw clenched, but she handed over the kit. The limping nurse didn't hesitate. She positioned the needle, found a landmark, and pushed it in with the kind of controlled force that only comes from doing it under fire. There was a hiss of air. The Marine's chest rose. His oxygen level started climbing. The room exhaled. The attending stared at her for a beat too long, then turned back to patient. Diane said nothing, but the younger nurse was watching now, really watching. The second patient came in minutes later. Another Marine, This one conscious but in shock, a deep laceration across his forearm and a suspected fracture. He was pale, shaking, eyes wide. The resident moved to starting 4, but his hands were still unsteady from the first case. He missed a vein. Tried again. Missed. The Marine winced, his breathing quickening. The resident swore under his breath. And before anyone could step in, the limping nurse was there. She placed a hand on the Marine's shoulder, her voice low and even. "Hey, look at me. You're okay. I've got you." The Marine's eyes locked onto hers, and something shifted. His breathing slowed. His shoulders dropped. She didn't say anything else. She just held his gaze while she slid the forward on the first try, smooth and clean. The Marine didn't even flinch. He nodded at her just once, and she nodded back, like they'd had a whole conversation in that silence. The resident stepped back, flushed with embarrassment. Diane watched from across the room, her expression unreadable. By the third patient, the whispers had started. The limping nurse had taken point on 2 critical interventions without being asked. She moved like she'd done it 1,000 times. No hesitation. No second-guessing. Just brutal efficiency wrapped in eerie calm. One of the paramedics, a former Army medic, kept staring at her. Finally, he leaned over to Diane and muttered, "Where'd you guys find her?" Diane shrugged. "She's new. Transfer from another hospital." The medic frowned. "She doesn't move like a hospital nurse." "What's that supposed to mean?" "I mean she moves like she's been in a combat zone." Diane didn't respond, but she was thinking the same thing now. There was something off. Not wrong. Just different. The way the limping nurse scanned the room. The way she positioned herself. The way she talked to Marines. Not like a nurse trying to comfort patient, but like someone who'd been exactly where they were. Like she knew what it felt like to bleed out on a table and trust a stranger to keep you alive. The 4th patient changed everything. He came in on a stretcher, flanked by 2 officers in dress uniforms. The ER staff recognized the insignia immediately, Navy SEAL Command. The patient was older, maybe late 40s, with close-cropped gray hair and a jaw that looked like it had been carved out of stone. He was conscious, alert, but his leg was mangled from the blast. Shrapnel wounds, deep tissue. "Daddy's coming home soon, princess. Don't tell Mommy about our secret phone. She gets sad when we talk without her." Sarah scrolled through the messages with growing horror. They started normal enough. A deployed father checking in on his daughter. But they shifted, slowly, into something else. Instructions. Demands. Reassurances that what was happening wasn't wrong. That their special relationship was something beautiful. That when he came home, they'd be a real family again, and Mommy wouldn't be needed anymore. The most recent message was from 4 days ago, sent at 11:43 p.m. "I know you're in the hospital. I know Mommy found some of our pictures. Stay quiet like I taught you. If you tell the doctors, they'll take you away and I'll never see you again. Be brave for Daddy." The girl had stopped screaming. Sarah looked up to find her standing in the doorway of her room, small and fragile in her hospital gown, staring at the phone in Sarah's hands. Their eyes met, and something broke in the child's face. Not relief, not fear, something closer to resignation. Like she'd been waiting for this moment, dreading it and hoping for it at the same time. Sarah's training kicked in on autopilot. She called security first, then Child Protective Services, then the attending physician. She documented everything, photographed the phone and the messages, bagged the pillow as evidence. But her hands were shaking so hard she could barely hold the camera. Because she'd seen cases like this before, knew what those messages meant, understood why the mother had brought her daughter in and then disappeared into supervised visits. The woman wasn't the abuser. She was trying to create a paper trail, a documented history of her daughter's distress, before she went to the authorities with what she'd found on the family computer. The girl finally spoke around 4 a.m., sitting in Sarah's lap in the break room while they waited for CPS to arrive. She explained how her father had given a phone before he deployed, told her it was their special secret, how he called every night when Mommy was asleep and talked to her for hours, how the conversations had started innocent and gradually twisted into something that made her skin crawl, but she didn't understand why. How, when her mother had found pictures on his laptop and confronted her, she'd panicked and hidden the phone in the only place she knew no one would look. And how every night since, lying on that pillow, feeling it beneath her head, had been like sleeping on top of her worst secret, unable to confess, unable to breathe. The mother arrived at dawn with 2 CPS caseworkers and a police detective. She'd been building a case for weeks, they explained, collecting evidence while keeping her daughter close, trying to create a safe environment for disclosure. But she'd underestimated the control he'd established, the fear he'd instilled. When Sarah handed over the phone, the woman's knees buckled, not from shock, from relief. This was the piece she'd been missing, the concrete proof that would keep him away forever. The senior charge nurse, who'd been so certain it was just deployment anxiety, stood in the hallway looking like she'd been slapped. The attending physician, who'd ordered sedatives instead of investigating, pulled Sarah aside and asked quietly how she'd known to look. She didn't have a good answer. Instinct, experience, blind luck, maybe just the privilege of being new enough to question the established narrative instead of accepting it. The detective made some calls, and within 6 hours, they had officers waiting at the naval base where the admiral was stationed, because that's who the father turned out to be. Not just military, not just deployed. A rear admiral with 30 years of service and a spotless record and enough authority that no one had thought to question his access to his own daughter. The kind of man whose word carried weight, whose reputation preceded him, whose position made him untouchable right up until the moment it didn't. The arrest made regional news. The hospital put Sarah on administrative leave pending the investigation. Standard procedure when a nurse violated protocol, even for the right reasons. She spent 2 weeks at home, checking her phone compulsively for updates, until a hospital administrator called her back in for a meeting. She'd expected a reprimand, possibly termination. Instead, they offer her a position in their child advocacy program, creating new protocols for identifying and responding to abuse cases. The senior charge nurse retired early. The attending physician requested a transfer. The girl was placed in protective custody with her mother, who filed for divorce and full custody before the week was out. The admiral was dishonorably discharged and charged with multiple felonies. His lawyers tried to argue that the evidence was inadmissible, that Sarah had violated the girl's privacy by opening the pillow without consent, but the judge wasn't interested. Sometimes the law bends when it needs to, when the alternative is letting a child's screams go unanswered. Sarah kept the photo on her desk after that. Not of the girl, that would be inappropriate, but that pillow, cut open, with the phone visible inside. A reminder that sometimes the answers we're looking for are hidden in the things we're trained to overlook. That authority and rank don't equal innocence. That a child's suffering is never just psychological, never just behavioral, never just something that will pass with time and patience. The other nurses still talk about that case during shift changes. They use it as a teaching moment for new hires. They've updated their intake protocols, added questions about communication devices and unusual gifts, created checklists for identifying coercive control in pediatric patients. But the real lesson isn't about procedure. It's about listening to what the screaming means instead of just trying to make it stop. Because that girl wasn't crying out from nightmares. She was crying out for someone to cut through the fabric of her carefully constructed prison and find the truth she'd been forced to bury. And somewhere in this world, there are other children sleeping on pillows that hold secrets too terrible to speak out loud, waiting for someone brave enough to look deeper than the obvious answer. If this story made you feel something, hit that like button. Drop a comment about what you would have done in Sarah's position. And subscribe, because there are more stories like this that need to be told, more moments where everything we assume turns out to be wrong, and more people who deserve to have their silence finally heard. Sometimes the truth isn't comfortable, but it's always worth finding.